This is Dr. Debasis Saha, Senior Consultant in Internal Medicine, Diabetes and Endocrinology, Manipal Hospital, Broadway, Kolkata, talking on awareness regarding World Diabetes Day and the disease process diabetes mellitus. These diabetes mellitus comprises of two types, type 1 and type 2 from simple point of view. And this type 1 comprises 5% of diabetic population, which is usually as a result of the insulitis, means beta cell destruction of the pancreas, and the remainder, type 2 is 95% of Indian diabetic population. In type 1 there is absolute insulin deficiency, but in type 2 the main etiopathogenetic factor is your insulin resistance. This insulin resistance with the Indians have got disproportionately higher scale as compared to the Caucasian because of disproportionately higher visceral adiposity. This insulin resistance is responsible for onset of type 2 diabetes in Indian at a much younger age, and coronary artery disease onset in type 2 diabetes Indian at a much younger age as compared to the Caucasian population. So the philosophy of management of type 2 diabetes mellitus, or so to say type 1, is aggressive and intensive intervention the moment it is detected. There is no place of inertia either on the part of the treating doctor or the patient. And where lies the necessity of treating diabetes mellitus? This needs to be explained to the patient in simple language. That is where lies the necessity of diabetic education imparting to the patient. Now, if you just keep the patient undetected, untreated, or inadequately treated, it takes only 1 year for the patient to develop neuropathy for as a result of involvement of the vasa nervorum, and it takes only 1 to 1.5 years for the kidneys to develop albuminuria and nephropathy, and 5 years to 6 years down the line, if the patients remain inadequately treated, untreated, or improperly treated, they develop macrovascular complications like coronary artery disease, cerebrovascular disease, and peripheral arterial disease. So the moment the patient lands in your clinic, it is the treating of the onus of the treating doctor to educate the patient regarding the disease process, regarding the possible etiopathogenetic factor, and regarding education for different types of diabetic medications, whether tablets or insulin, and they should be communicated in detail to the patient from the very first day. These diabetes mellitus, the patient either may land in a undetected condition, or they may be detected for the first time in the dentist chair or optometrist chair, or the patient they need treatment whether whenever they are admitted in the ICU wards as a result of pneumonia, heart failure, CKD, or perioperative procedures, or gestational diabetes, or pregnancy diabetes management. So the cases are managed accordingly, aggressively, and the basic principle is never to cause hypoglycemia in the patient. The principles again are to avoid wide downward glycemic variability and to make the patient adhere to time in range in a much better way, so that there is no adverse microvascular and macrovascular complications. And this 14th November is usually observed as World Diabetes Day to commemorate the birthday of Sir Frederick Banting. And the theme of this 2025 World Diabetes Day is diabetes and well-being. So the patient should be educated so that they don't develop complications either macrovascular or microvascular, as I narrated in detail. And that was the purpose of today's talk. Thank you.